With a new daily COVID case record set twice this week, the Arkansas Department of Health is closely monitoring the surge.
Yeah, 5 News reporter Catherine Gilker tells us the department has a serious message it says it wants everybody to hear.
The Arkansas Department of Health reports more record numbers today, with Washington and Benton counties having more than 2,000 active cases. In Sebastian, they have just under 900, and Crawford almost has 400. There are currently 819 people in the hospital with COVID statewide. 103 of those patients are in Northwest Arkansas and 95 are in the River Valley. Dr. Sharkey with the Fayetteville Board of Health says they expect our hospitalization numbers to keep increasing in the coming weeks due to the large number of cases.
Vaccinations and boosters are critical with this variant. We're seeing very mild illness in people who are vaccinated and boosted. In people who are just vaccinated, they're a little bit more sick, and people who aren't vaccinated at all are unfortunately the ones that we're seeing ending up in the hospitals.
Dr. Jennifer Dillahay with the Arkansas Department of Health says if you develop symptoms, stay home and figure out where to get tested. She says if you can't get tested, you need to stay home for 5 days under the current CDC guidelines. If you're fever-free after that, you should wear a surgical or KN95 mask for another 5 days.
People who have been exposed, if they are fully vaccinated and boosted, they do not need to quarantine. They need to wear a mask wherever they go for at least 10 days.
For people who are not vaccinated or boosted, they need to quarantine for 5 days and then wear a mask for another 10 days. Dr. Dillahay says if you have been exposed to the virus and are vaccinated and boosted, you don't need to quarantine. Just wear a mask for at least 10 days. In less than 2 weeks, the Arkansas Department of Health will stop contact tracing, and they will only do case investigations for people under the age of 18. She says they made this decision because of the number of cases, and they need to focus on supporting schools.
We don't have sufficient case investigators or contact tracing for all of these people who are now infected or are having to quarantine. So this actually puts more responsibility on the general public.
In Fayetteville, covering news where you live, Catherine Gilker, 5 News.
It is recommended that people wear a mask in public, but a surgical or KN95 is the better option for masks.